Lastly, in this section we have some pharmacokinetic calculations. Some single-dose equations include one that we've reviewed already, the volume of distribution equation, dose divided by C0. We've already talked about that. That would be a good equation for you to know for your exam. Remember, they're most likely to give you C0 and VD and ask you to calculate dose. Secondly, we have the half-life equation. And while there's a possibility that you're going to be asked to calculate this equation, I think there's a greater chance that you'll be asked just simply to use your knowledge of this equation in order to answer a question. So knowing the equation either way is still valuable. The half-life is equal to 0.7 times VD divided by clearance. And I'll point out the relationship between these variables. Do you notice that half-life and volume of distribution are directly proportional? For example, increasing the VD is going to increase the half-life, assuming clearance stays the same. And notice also that clearance and half-life are inversely proportional. Okay? And you know, of course, that if renal function declines and you decrease renal clearance, that the half-life is going to go up. The drug is going to last longer in the body. So understand the relationship between the variables to understand that equation. Multiple dose or infusion rate equations are shown next. The infusion rate, the K0, is clearance times your CSS. Okay? And that infusion rate equation fits in very nicely as part of the maintenance dose equation. Notice essentially that the maintenance dose is the infusion rate times tau. Now, tau, of course, is your dosing interval. It's how frequently you're going to dose. That could be once a day, that could be 4 times a day, and anything in between. So tau is your dosing interval. Notice also that the maintenance dose equation factors in clearance. In other words, if you're going to give a drug over time, which is what you would do with a maintenance dose, you must know what the kidneys are doing. You must know what renal clearance is. So clearance is a very important variable in your maintenance dose equation. Notice that in the loading dose equation, clearance is not factored in, only volume of distribution. Again, this is not done over time, so renal function is not considered for a loading dose equation. Notice also that both equations, both the loading dose and the maintenance dose equation, factor in F. Remember, F is bioavailability. Now, of course, if the question told you that the drug was administered IV, then you know that the F value is 1 because it's all available. It's 100% bioavailable. So if an F value is 1, then you don't have to worry about changing your calculation. However, if the bioavailability is less than 1, you're going to have to adjust your dose accordingly. If it's 0.8 or 0.5, you're going to have to divide by F. Finally, both loading dose and maintenance dose equations factor in some type of plasma concentration. Okay? For the loading dose, it's really more of a target plasma concentration because you're not really trying to maintain a steady state with a loading dose. You're just trying to get to a certain plasma level. But it is technically correct to say that with a maintenance dose equation, you're trying to achieve a CSS, a concentration at steady state that can be maintained in the plasma. And of course, maintenance dose over time, loading dose usually one time only.